So many people have or work for a company that their company is self-insured. So meaning that company pays for the majority of the cost for whatever medical issue you have. And so the company I worked for in the past, we were self-insured, and I mean we had I think 150 employees at the time, and our health plan. This is 10 years ago. Our health plan from our side was $50 million then. And now you look at the cost of medicine, the news is out there. Hey, medical costs are rising by 25 to 30% this next year. All these companies are out there looking to save money, and I can't blame them, but they're looking in the wrong places. So if you work for a company and you know that their company is self-funded, they're looking to help you get good care at a better price, rather than the standard care out there that is going to be much more expensive, right? What I would call the system is creating high cost, and those high costs are very difficult for your employer to pay, because these high costs are they're exaggerated costs, and they don't need to be this way. So one example is surgery. So a lot of companies are having their employees, excuse me, they go to a surgical center, a cash surgical center, and that surgical center says, "Oh, hey, so you need a knee scope, and that knee scope is going to cost $7,000." Okay, but if you went that through a hospital system, that may have costed $20,000. Okay, yes, you saved money, but did you really save? You sit there, if you look at our technology, Go4 Recovery technology allows us to treat those conditions without surgery. We using our technology, using the electromagnetic energy and our energy-based devices, we can stimulate that tissue to heal at a high level. We can remove the need for surgeries. We can reduce the risk of long times off for surgery recovery, and the complications of surgery, and the drug interactions, and the anesthesia. We can eliminate all of that. And so they say, "Oh, well, that's great, but we know that this surgery works, and this is fine." And again, you don't know how technology works. If our technology allows us to achieve all of this without breaking your skin, without stopping you or losing a day of work, or losing a day of activity, or losing a day of your playing with your kids. You don't lose any of that as you're going through our treatments. And then our treatments, even when you're going to these discounted surgical centers, are far cheaper than the surgery itself. And I tell people, when you're buying our process, so on average it will take 10 to 12 treatments. So you're talking roughly 2 weeks, maybe just slightly longer. You go from bad to good, start to finish, in 2 weeks. And they go, "Well, the surgery, it's just we get the surgery done and then we're done." No, you're buying an hour of surgical time for $6,000, $7,000, right? But then you also have now 10, 12 weeks of recovery because of that surgery. And that requires time off, recovery time, physical therapy, not, the medications, the complications of the surgery. What if this person didn't? What if this person got an infection? What if the hardware they put in failed? What are all the other things that happen? And unfortunately, that's the way surgery is. What you're buying is a maybe. What you're buying is, I hope. Right? So good surgeons doing good work still can have problems. So hardware can still fail. Tissue may not be as healthy as that you hoped it would be. What if you didn't have to worry about any of that? What if you just can turn on a machine, treat the body, and get better, rather than have to worry about that for far less, and no 10-week window of, hey, it's this time to recover? What if you can have your employee back to work tomorrow? Or only miss a day or two here just because they're coming in for treatments? Isn't this what, as an employer, and even as being the employee, isn't this what you want? Do you want to be told by the employer, "Oh, I would rather you go through this 10-week surgical process and the risk of the complications and the risk of the surgeries, rather than I would rather have you just go over to this office and spend an hour in getting these treatments done, and hey, we'll just do 10 or 12 of these and you're all done, and come back to work and do a normal day and live a normal life and get better." And I think for employers and employees, you need to understand what you're buying. Just because you got a cheaper surgery doesn't mean you got a cheaper process. You're buying all the other processes. You're buying the opioids, you're buying the opioid addictions, you're buying the complications, the medical complications, the surgical complications. You're buying all of these other things, right? Surgery has known difficulties, and some people, and based on your age, based on your health, based on other complications, have higher risk, right? And so all of those costs go up. It's not just the cost of the surgery, it's the cost of these next 10, 12 weeks, if not even months, based on how this person's recovering. So why are you buying the old problems you know about rather than not buying the new product that has none of these problems? Wouldn't you want to know that, hey, I can get this better, cheaper, safer, and more effectively, and save my company significant amounts of money rather than go through the old-fashioned way that requires it to be much more expensive, not just monetarily, but time-wise, production-wise, the whole 9 yards. So it's really becomes it's an economic decision, and you need to understand technology wins, right? Technology has the power to heal, and that's what we are. We're at Go For Recovery as a technology company. We are employing very unique energy-based systems that allow us to stimulate healing and endogenous stem cell healing, meaning from your own body, and that we can, as we apply this power safely and effectively, your body will recover. And your body knows how to heal better than any surgeon. Your body can repair any tendon, any ligament, any joint, any muscle far better than a surgeon, because they're repairing it all the way down to the cellular level. And when we stimulate the body to make it heals completely. Surgery can only partially, right? I heal without scars using our technology. The best surgery can do is a scar, right? So right there, we've won. If I don't have to create a scar, you have far less problems. So technology wins. And if you're looking for the value of getting better and reducing your risk and reducing costs, then you need to look at these technologies, especially the technology that we have at Go For Recovery, because it's proven, it's been long-standing. We get long-term outcomes, and patients are supremely satisfied with this. I wanna read a quick review, because I think this points out exactly the problem that people are suffering, and they don't realize this. And I think this review came in just recently from a patient that we took care of, but I think it really, I think, summarizes a large percentage of the population out there, and what they're going through with their health and with their body. So this patient wrote, it says, "I'm struggling to find words that are adequate to capture the incredible experience I've experienced at Go For Recovery. For years, I dealt with chronic ankle injuries resulting in a lifetime of playing basketball and other sports. My ankle would frequently turn and sprain and injure, and over time it became weaker and weaker and plagued by persistent swelling and pain and ligament damage." It goes, "The discomfort became so severe that even walking was excruciating. I couldn't navigate even the surfaces and I couldn't navigate uneven surfaces and struggled to walk my dog on simple walks. Several specialists in the area told me surgery was the only viable option, potentially to repair the long-standing damage. That all changed after I visited Dr. Hecker and Go For Recovery. Just within a couple months of receiving state-of-the-art treatments, the pain and swelling were completely gone. I can now walk normally, enjoy hikes, take my dog on long walks without any limitations. I first became aware of Dr. Hecker and Go For Recovery 8 years ago when my son, also a basketball player, was told by another orthopedic that he would need surgery to recover from his own ankle injury. After just 4 weeks of treatments with Dr. Hecker, he was back on the court and went to play Division I basketball. That's what we can do. You can take a chronic injury that's been going on for this a patient's lifetime. She started injuring her ankle when she was a high school athlete, and she was a very aggressive athlete. And injury after injury after injury, she damaged the tissue to the point she was even having difficulties with walking. And within a short period of time, so they say months. So we do our treatments typically twice a week in our office. So when we do go for recovery, and we can do them every day, we can shorten that, we can lengthen that. So you come in and you get 12 treatments done. It's going to take you 6 weeks. So we go 2 a week. So that's why they're saying it takes months. But I think the key is in that time frame, you go from, oh my God, I can't do anything, to there's nothing I'm limited to. With her son, the same way. He has a bad injury. This is going to restrict his ability to play college sports, if even get back to playing college sports. And within a few treatments, he's back to playing, and he has a great career as a basketball player. This is what people are unaware of. You don't need to go through these issues. These surgeons are not bad guys. They're just unaware that this technology is far better than what they can accomplish. Her options were fusions of her ankle, and that is a very problematic issue, and that rarely has long-term good outcomes. How about just get a healthy ankle back? How about just repair the ligaments and the tendons that have been damaged so badly that they can now do and function normally? And people say that can't be true. I live this every day. This is what Go for Recovery does. Why are you spending $6,000 for a surgery when less than that you can get these great long-term recoveries and have happy employees, happy lifestyles, restore back, go walk your dog, go hike, go enjoy, right? Think about the technology, and I encourage you to think about Go for Recovery